Welcome back. We close Chapter 8 with patients who face some of the steepest barriers in all of dentistry, people with intellectual and developmental disabilities. Start with the first ethical fact, the access gap. Too few dentists are trained or willing to treat this population. That connects to the workforce and justice themes of Chapter 6. And this book argues that developing this competence isn't just admirable, it's part of the profession's obligation. On consent, some patients have guardians, yes, but many patients can participate in decisions far more than is assumed. So the respectful default is supported decision making, helping the patient decide rather than deciding for her. Ask and adapt. You'll often be surprised by how much a patient can engage when someone takes the time to try. Then the careful part, behavior management. Sedation and protective stabilization can genuinely make needed care possible, but they carry real risks and they can shade into coercion. The governing principle: use the least restrictive effective approach with genuine consent from the patient or her surrogate X, and never for the practitioner's convenience alone. It's faster this way is not an ethical justification. Now let's gather the whole chapter. 3 populations: children, older adults, people with disabilities. What unites them is a gap. Their dignity is full and equal. Their capacity to protect their own interests is reduced. And that gap generates heightened obligation, not diminished attention. The imago Dei grounds a dignity that does not rise or fall with capacity. Pikuach Nefesh and the Good Samaritan press the practitioner toward exactly those the system most often fails. Here's the sentence to carry, and honestly, it may be the best single test of a practice. The measure of a practice is how it treats the patient who cannot advocate, complain, or pay. Because dignity does not depend on capacity, and the most vulnerable patient is fully a neighbor. Next, Chapter 9, where we turn from who the patient is to the integrity of what the dentist knows and does: research, evidence, technology, error, and accountability.